Hi, my name is Heather Ramos, and I'm going to be performing the intramuscular injection skills video. I'm in my school uniform and I have my school badge. I have no artificial nails or no polish, and I'm just going to do a quick room scan before I begin the video so you can see my environment. Let me just unplug my laptop. All right, so today I have with me Mr. Smith. I have the box that my laptop is sitting on, and then I have the supplies to the right of me. Plug it back in. Today, the physician has ordered 6 milligrams of morphine to be administered intramuscularly times 1 dose for Mr. Smith. So I'm going to verify the physician's orders and the patient's EHR using the 6 rights of medication administration, which is right patient, right medication, right dose, right route, right time, and right documentation. I'm in the med room and I'm going to be gathering my supplies. So I have a vial of morphine that reads 4 milligrams per ml. So I'm going to be administering 1.5 mLs of medication for the patient. So my supplies include the morphine vial. I have a 3 ml syringe with a 25 and 1 inch needle. I have a gauze pad and 2 alcohol prep pads and gloves. So I have verified the orders. I have gathered my supplies. I'm going to go in the patient's room, close the door, the curtain for patient privacy, and perform hand hygiene and introduce myself. Hi, my name is Heather, and I'm going to be your nurse today. Can you please verify your full name and your date of birth, and then verify 2 patient identifiers using the patient's wristband? Thank you, Mr. Smith. Can you please tell me if you have any medication, food, or seasonal allergies? No. So now at patient's bedside, I'm going to review and confirm in patient's EHR, in his chart, that he does not have any allergies as previously stated. I'm also going to be reviewing the physician's orders again and confirming that I have the appropriate medication, and also just confirm that patient doesn't have any contraindications. All right, Mr. Smith, doctor has ordered morphine for you. It is a pain medication to treat moderate to severe pain. It is an opiate, and the way that it works is that it blocks the pain receptors in your brain and spinal cord and also alters the perception of pain. There may be some side effects, which include dry mouth, drowsiness, or difficulty urinating. I need you to report any signs of adverse reactions, which include nausea, vomiting, hives, shortness of breath, or chest pain. If you experience any of those symptoms, I need you to let me know immediately. Please hit your call light button. Okay, those are less common, but if they occur, please let me know. You may experience a burning or a stinging sensation when I administer the medication. That's not from the medicine, that's just from the injection itself. Now, before we begin, do you have any questions for me? No? Okay, so I'm going to perform hand hygiene, and then I'm going to put on some clean gloves. So I confirmed that I have the appropriate medication. So I have my morphine vial here. I'm going to pop off the cap, if there is a cap on here, and discard in the appropriate sharps container. I'm going to take one of my alcohol prep pads and clean the top of the vial, including the rubber top of the medication. I have my appropriate size syringe, so I have my 3 ml syringe here. With the cap still on, I'm going to go ahead and pull down to the plunger to 1.5 mLs, which would be equivalent to the 1.5 mLs of medication that I'm going to be administering to the patient. I'm going to carefully remove the cap, insert the needle into the vial, inject the air, invert, and pull down to 1.5. Now I'm going to make sure that there's no bubbles. All right, and we are at 1.5. All right, so 1.5. Where is that? 1.5 mLs. So I'm going to go ahead and use the single scoop method to put the cap on. If I'm preparing this away from patient's bedside, I'm going to label the syringe with the patient's name and the dose. I'm going to set this aside. Now I'm going to select the site. So for IM injections, you can use the vastus lateralis, you can use the deltoid muscle, or you can use the ventrogluteal site, which is going to be my preferred site. I'm going to assess the patient's skin and the integrity of the muscle. I'm going to look for any skin irritation. I'm going to look for bruising or any edema. I'm also going to assess for any irregularities or abnormalities, palpate for any tenderness or hardness. If there are any abnormalities noted, then I would rotate using a different site. Likewise, if this is the patient, if it has been frequently used for another injection. Now I'm going to use an anatomical landmarks to locate the site. So I'm going to place the heel of my hand on the patient's greater trochanter with my thumb towards the patient's groin. My index finger will be along the anterior superior iliac spine with my middle finger towards the iliac crest going towards the buttock. It's going to be forming a triangle position. And my injection site will be in the center of that area. Now that I've located that, I'm going to clean the area with another alcohol prep pad. I'm going to place the prep pad in the center of the selected injection site. And in an outward circular motion, I'm going to clean the area. It's roughly 5 centimeters or 2 inches. I'm going to allow that to dry completely. Do not touch or wave or blow on the area. Once that is dry, I'm going to take my non-dominant hand and either gently pull the skin tight or slightly grasp the muscle to increase the muscle mass. I'm also going to position my ulnar side and hold the position there just below. So I'm going to hold the position just below and hold it there until injected. With my dominant hand, I'm going to take the syringe between my forefinger and my thumb. I'm going to carefully remove the cap. At a 90-degree angle, I'm going to insert the needle. I'm going to stabilize using my non-dominant hand by grasping the lower end of the syringe barrel. I'm going to take my dominant hand and pull the plunger back for about 5 to 10 seconds. If I do not see any blood, then I'm going to inject the medication slowly, about 10 seconds per ml. And once injected, I'm going to hold for about 10 seconds. Then I'm going to smoothly and steadily release or withdraw the needle and discard into a sharps container. I'm going to place a gauze pad over the injection site and apply gentle pressure. I'm not going to massage. I'm going to remove my gloves. I'm going to perform hand hygiene and then document that I just administered medication to the patient.